Good morning, I'm Dr. R. Deuk Laser, and I'm here with one of my patients who had surgery just 7 weeks ago.
Yes.
And you're back to visit me from Miami, right?
Yes, I am.
How are you feeling?
I'm definitely, the nerve pain is gone, so I'm very happy about that. And my range of motion, I hardly did this for entire 9 months before the surgery. So, boom, there it is. Boom. And muscles are, you know, from here, it gotten loosened right away, and range of motion is great. I'm pushing more, I'm pulling more. So I'm driving better, I'm doing computer work better, so it's been a wonderful experience. So thank you so much.
You're welcome. I know we're still working on the
Yes.
stiff muscles, and that
Yes.
takes time. You just came out of your collar,
Yeah.
so we'll give it a little bit more time. Do you feel like the surgery is going to improve your quality of life?
Oh yeah. I want to go back to dancing, I want to go back to running, and do more physical stuff that I've been so nervous about because the herniation was always giving me the nerve pain, but that was right away on the day 2. Day 1 was gone really. So now I just want to go back into bouncing.
Yeah.
That's possible, yes.
What kind of dancing do you do?
I do ballroom Latin dancing.
Wow.
So lots of hip movement. So that's
Yes.
allowed too?
Yes, absolutely. Absolutely.
Yes.
As long as he agrees that it's allowed.
Yes. No, but I'm very happy.
Good.
I'm very happy.
No,
Thank
good,
you.
good.
He is the best in the world. So guys,
Thank you.
yeah.
You had the Deuk Laser Disc Repair endoscopic.
Yes.
And
Yeah.
can you show us your incision?
Yeah. Can you see this? Here it is.
Can you see it?
Wait, I have to touch it. There's a
Can you see it?
No, I can't see it, but there's a little pimple right there.
Yeah.
Can you see it?
It's pretty much gone, right? I mean, you can't see it in the mirror when you
Yeah,
look
can't
at
really
your
see
neck.
it.
So it's tiny.
Yeah.
It's 4 millimeters. And are you happy you had that tiny incision rather than a big,
Oh my
ugly
gosh,
scar
it's-
from open surgery?
Oh no, I have seen people had really big, scars, and I don't have it. I don't even have to put a makeup on top of it, so that's great.
And how was your whole experience at Duke Spine?
You guys are tip-top professional. Everything from the beginning to the end. Absolutely wonderful experience. When you're in pain, you're so nervous and you want to cry, and everybody's just smiling and saying it's going to be okay. I'm crying now for joy.
But they don't know how to make it okay, do they?
That-
The other people. I mean,
yeah.
yeah, they can
No.
say it's going to be okay, but it's not okay.
No,
I mean, not
but it
when
was
you're in
like
pain every
everything,
day.
the process, because you're so nervous, like what's going to happen next, and what's going to happen next, and what's going to happen next, and everybody's so supportive, so thank you guys.
Well, I'm going to tell you what's going to happen next. You're going to go on and have a normal life, and you're going to be very, very happy.
Thank you so much. Thank you.
Have a safe trip home.
Thank you.